we see 3 groups of patients who have a knee replacement, and the best way to demonstrate it is to draw a little graph, and I will draw it and then I'll turn it around so everyone can see it. And this is the happiness graph, and we've got 3 groups. We have 10% of people very, very happy. We have 75% of people to perhaps 80% of people glad that they had the surgery, but they wouldn't use the word happy because their knee doesn't feel normal. Mm-hmm. And then we have this failure group, and it's perhaps as high as 15%, with a 2% complication risk. So if I turn that around, mm-hmm. we've got 2% of patients who are unhappy because they've had a major problem.
Okay.
So that's low. We have 10% who thinks it's the best thing that's ever happened. It's like a perfect knee. Well, the pain has been reduced so much that they just feel that it really is fantastic. And if we were drawing this for hip replacements, this group here would be much larger, it'd be like 80 or 90%. But it's not the same for the knee replacements. It's a much more sophisticated joint. It's not a simple ball and socket. It's a very superficial joint, and it invariably does not feel normal. It clicks, it swells. People often can't kneel because they have a scar down the front of their knee that then prevents them from doing their gardening. A lot of people like to do stuff on their knees, such as gardening. Yeah, and you often can't if you have a knee replacement. On the outside, she heard a pop, so that's classic of an ACL injury. Did it swell up?
Yeah, straight away.
So again, immediate swelling is another key, and these things will be told by the patients to you almost every time. So I heard a pop, the knee suddenly swelled. Could you play on?
No.
So she was unable to play on, and you were presumably hobbling around after that.
Yeah.
And most people get back to walking reasonably well. How long did it take to start to sort of walk reasonably normally?
Probably about a good week after, because I was on crutches for a while because the swelling was so...
So we often hear that as well. So we hear about individuals who hobble around for 2 weeks and then they start to walk relatively normally. Did you go to A&E at all?
Yes.
Did you see a doctor or a nurse?
A nurse.
So in this country, 98% of people will see a nurse and they won't see a doctor. And if they do see a doctor, chances are they see a very junior doctor. And the ENP nurses will see the patients. Did they take an x-ray?
Yes.
So most people get an x-ray, and you should get an x-ray, but the chances of actually seeing a fracture are very small. We do occasionally see it, so it's an important investigation, but usually we don't actually see anything on the x-ray. That reassures the nurse, who then tells the patient there's nothing on the x-ray, don't worry about it.
Yeah.
So we're seeing a lot of head nodding going
on.
Then the patient tries to get back to sort of normal activities, and then at some stage in the first 3 months they usually present to their GP. So
yeah, what happened was I went home and I was just doing general daily chores around the house, and next thing my knee, it was swelled right back up again, and I was in excruciating pain, and it kept popping out, as if it kept popping in and out. I could feel it.
You could feel it going on you, so you were having instability.
Yeah.
So she's describing the laxity that you get and the instability you get when you tear your ACL. So that instability is usually the biggest problem for people in the early stages, as opposed to pain. They normally complain of a wobbly knee as opposed to a painful knee. Usually it's both, but the wobbliness is the bigger of the two problems. So when you first presented to your GP, can you remember at what stage you're at? So was it after a month, 2 months, 3 months, 6 months?
It was pretty soon after. I'm sure it was within the first month.
Within the first month. Well, that's very good. And what was done for you?
I was given tablets, pain relief.
So painkillers?
Yeah, and I was referred to physiotherapy.
Good, okay. And what did the physio say about your knee? What did they...
They said to build the muscles up around it.
Yeah.
They were trying to concentrate on my quads and my hamstring muscles mainly.
And at this stage, the main problem for you is instability, is that right?
Yeah.
So there's no place in a young person to go down that route. You know, in this day and age, someone who's torn their ACL, it's quite clear from that history that's what the problem was. She should have been referred in, seen a knee specialist, and had an appropriate investigation MRI scan to sort of nail the diagnosis and then plan the reconstruction, because the problem is it carried on being unstable, didn't it?
Yeah.
So at what
I
stage?
never had an MRI scan until I was transferred here.
Okay. So you saw, eventually you did get to see an orthopaedic surgeon.